So, hello students. Our today's topic is developmental disturbances of the teeth. So, first of all, we classify the dental anomalies either on the basis of their shape, number and eruption, shape, or defect of the enamel and the dentine. Based upon the number, they can be either hypodontia, hypodontia. Based on size, they can be microdontia, macrodontia. Based on shape, they can be germination, fusion, concrescence, accessory cusp, dense invaginatus, taurodontism. Based on structure, amelogenesis imperfecta, dentinogenesis imperfecta, dentine dysplasia type 1, type 2, or the regional odontodysplasia. Now let us discuss the developmental anomalies based upon the size. Based upon the size, they can be either microdontia or the macrodontia. The microdontia is the term we use when the teeth they are smaller than they usually should be. So which teeth they are most commonly affected in microdontia? They are the maxillary lateral incisors. They are the most common affected tooth. They tend to look like a peg with a small crown and usually normal size root. So remember, the tooth they have a small size crown and they have a small crown and the root is usually normal in size. The isolated microdontia, they often affects the third molar. So which teeth they are most commonly affected? They are the maxillary lateral incisors and the third molars. Now the microdontia, it can be of three types. They can be either true generalized microdontia, relative generalized microdontia, or the focal localized microdontia. What is true generalized microdontia? The true generalized microdontia, this is when all the teeth in the mouth they are smaller than the normal. So all teeth in the mouth they are smaller than the normal. It is true generalized microdontia. It affects the primary teeth and the permanent teeth. Occurs due to the genetic factor. Which condition is associated with the true generalized microdontia? Remember, pituitary dwarfism. It is also known as growth hormone deficiency. So what is that condition? It is a condition where the body does not produce enough growth hormone. So if the body does not produce growth hormone, what would occur? That would lead to stunted growth and development, including smaller than the normal teeth. That is the characteristic feature of the true generalized microdontia. The second is the relative generalized microdontia. So this refers to situation where the teeth might appear smaller, but it's because they are crowded within a small jaw. So the teeth they are actually of normal size, but they look smaller due to the lack of space in the jaw. The third one is the focal or localized microdontia. So when the certain teeth they are smaller than they should be, it is focal microdontia, while the rest of teeth they are normal. So to sum up, the true generalized microdontia affects all teeth. The relative generalized microdontia involves crowding, making teeth appear small, whereas the focal microdontia is about specific teeth being smaller than the usual. The next terminology is the macrodontia. What is macrodontia? When teeth they are bigger than they usually they are. Just like with the microdontia, we use this term when the teeth they are physically larger and not when the when the normal size tooth, they are crowded in the small jaw. So similarly, it can be true generalized macrodontia, relative generalized macrodontia, or localized macrodontia. True generalized macrodontia, condition when all teeth in the mouth are larger than the usual size. The relative generalized macrodontia, the true generalized macrodontia, it is associated with the pituitary congetism. The relative generalized macrodontia, when the teeth appear larger, but it's because they are crowded within a small jaw. So the teeth here might look bigger due to lack of space in the jaw. The third is the macrodontia of the single tooth, when only one tooth in the mouth is larger than the normal size. It is when a single tooth grows larger than the expected. Next are the based upon the number and eruption of teeth, we can classify the dental anomalies into supernumerary, anodontia, or impaction. Now, what are supernumerary teeth? How many teeth are present in oral cavity? 32 teeth. So suppose if a normal teeth if 34 teeth are present in addition to the normal tooth, we call it simple as supernumerary teeth. So there are 4 types of supernumerary teeth: conical, tubercular, supplemental, or odontome. Now the conical, these are referred as peg-shaped supernumerary teeth. They have a pointed or conical appearance, and they are smaller than the regular teeth. They are seen most common type. They are the conical. They are the most common type, seen in the front, in the anterior region of the mouth. The tuberculate supernumerary teeth. The tubercular supernumerary teeth, they have complex shape with multiple cusps or tubercles, so they can resemble the shape of normal molars, but they are usually smaller. The third are the supplemental teeth. They resemble the normal teeth in shape and structure. They resemble the regular teeth of same type, incisors, canine, molars, etc. The others are the odontome teeth. Odontome teeth, like this, you can see they are the benign, slow-growing tumors that can form during the tooth development. So they consist of dental tissue in a disorganized pattern. So what are the most common supernumerary teeth? They are the mesiodonts, where they are situated between the maxillary central incisors. So the supernumerary teeth, they may be seen in various syndromes, like you can see here cleidocranial diastosis, where you can see multiple number of teeth. The other terminology is what is paramolar. The paramolar, it is a type of supernumerary teeth that forms next to the molar teeth. It can either appear on the buccal surface of the cheek or the lingual side or the tongue side of a molar tooth. What are the diptomolar teeth? Diptomolar teeth that are seen behind the last, that is the third molar in the dental arch. So they are located. They will be located distal to the third molar. The next terminology is what is anodontia. Anodontia is lack of the tooth development or absence of teeth. That is the true anodontia or congenital absence of teeth. It can be of two types, total or partial. The total anodontia, in which all the teeth will be missing, it can involve the deciduous or the permanent dentition. False anodontia, it occurs as result of extraction of all the teeth. While the term pseudoanodontia, the pseudoanodontia is applied to the multiple unerupted teeth. So that occurs due to the true failure of the dentinogenesis. The pseudoanodontia is sometimes applied to the multiple unerupted tooth. What is hypodontia? Hypodontia is a dental condition where person is missing a few teeth, typically less than 6 teeth. Oligodontia is a more severe form in which person is missing more than 6 teeth. Now let us discuss the gene mutations. There are certain gene mutations that can lead to different pattern of the missing teeth. The first is the PAX9 gene. It mostly affects the permanent molars. Severe cases includes the missing primary molars, second premolars and central incisors. Other is MSX1 gene. It is affected in individual that shows the front tooth loss. The most common missing teeth, they are the second premolars and third molars. Other is ZHAO deficiency. It affects the Chinese, and the gene that could be seen in Pakistani is LTBP3 gene. Other is EDA gene. It affects the maxillary, mandibular, central incisors, lateral incisors, cuspid and premolars. Other is WNTHA gene. It causes hypodontia limited to maxillary and mandibular lateral incisors and second premolars. Other is AXIN2 gene. Now let us discuss the anomalies based upon the shape and the form. The anomalies seen in the crown are the fusion, germination, taurodontism, talon, cusp, Leon cusp. Dense invaginatus, peg-shaped lateral, Hutchinson's incisors, mulberry molars. And seen in the root, they are the concrescence, enamel pearls, dilaceration, flexion, ankylosis. Now what is fusion? So imagine there are two tooth germs that come into contact due to the physical force or the pressure. So they will fuse together, forming a enlarged single tooth. So this This fusion involves the both crown and the root fusing through the dentine. So if this contact happens earlier, before the calcification, a complete fuse to germ is formed. If contact is later, only the root might fuse. Fusion is when two separate tooth germs join to make one tooth, often leading to missing tooth in the contact. The other is the germination. Germination, it happens when the single tooth tries to split, but it doesn't fully. It creates a tooth with split crown and usually a shared root and a canal. So the result is a tooth that look like two, but it is actually a one tooth. So this figure represents the germination, that is fusion of the two teeth from the single enamel organ. So this figure represents a bilateral germination. You can get the question in your image based question, image MCQ. Identify this along with the diagram. So this is example of germination. So the tooth count here was normal when each enameller tooth was counted as one. So this is germination. Other is concrescence. What is concrescence? Concrescence is the fusion. It is condition where two teeth form, in which two fully formed teeth, they are joined together through the cementum, that is the hard tissue that covers the root of the teeth. So this joining usually happens along the root surface of the teeth. It is more common in the molar teeth, particularly in the upper jaw. Other is the taurodontism. So what is taurodontism? Imagine a tooth that looks a bit different from the usual ones. In taurodontism, so taurodontism, the bottom part, the roots might be longer. So in taurodontism, the roots part may be the longer. In space for the top part, the crown part might be smaller. So it is like the root are stretching down and the crown is squeezed up. So that makes the tooth look like a bull's head. So that is why it is known as tauron, that means the bull in the Greek, where the roots, they are like the horns and crown is the head. So the taurodont teeth, they have different forms: hypotaurodont, mesotaurodont and hypertaurodont. The most extreme form is the hypertaurodont. The taurodontism can affect deciduous or permanent teeth, but it is more common in the permanent teeth, usually affect the molars sometimes. On the radiographic feature, the X-ray, they are best to see the taurodontism. The affected teeth, they are rectangular, no tapering toward the roots. The pulp chamber is huge, taller than the usual. The roots are short than the normal. The bifurcation, that is the split point, the bifurcation or trifurcation, it may be very close to the roots, to the root tips. So there is no specific treatment for this condition. Other terminology. So the resulting pulp chambers will have increased apico-occlusal height. So what are the conditions that are associated with the taurodontism? Down syndrome, Klinefelter syndrome. Remember all these syndromes that are associated with the taurodontism: ectodermal dysplasia, Ellis-Van-Creveld syndrome, hypophosphatasia, Klinefelter syndrome, trichodonto-osseous type 1, 2, 3. Remember all the types for your entrance exam point of view. So this figure you can get in image-based question. Identify this anomaly. It is taurodontism. You can see the mandibular teeth exhibiting increased pulpo-occlusal height with apical position, pulpal floor and bifurcation. Other is the dens evaginatus. It is also known as central tubercle or Leong's premolar. It is a cusp-like elevation of the enamel that is located in the central groove or lingual ridge of the buccal cusp of the premolar or the molar teeth. Imagine a small extra bump on the top part of your back teeth, that is premolar or molar. So this bump can be found in the central groove or the inner ridge of tooth outer point. Other is the talon cusp. It is a well-defined additional cusp that is located on the surface of the anterior teeth, and it extends at least half of the distance from the cemento-enamel junction to the incisal edge. Talon cusp is like an extra bump on the front teeth. They are found in the permanent teeth, on the front side of teeth, maxillary lateral incisors most common, then central incisors less commonly seen on the lower front teeth. They look like a three-pointed pattern, kind of resembling an eagle's talon. So talon cusp has been seen in people with certain medical conditions. They are seen in the Rubin-Stabbes syndrome, Mohr syndrome, Ellis-Van-Creveld syndrome and others. Remember them for your exam point of view. Dens in denti. It comes from the early invagination, that is fold on the tooth surface before the tooth calcify. So it happens when the tooth is still growing. So the invagination is due to the pressure or uneven growth in the tooth bud. Dens invaginatus. It is a condition where the crown or root of the teeth develops a steep fold lined by the enamel. So they can be coronal, present in the crown, and the radicular form. Coronal dens invaginatus is more common, seen in the front teeth, permanent lateral and central incisors, as well as premolar, canine and molars. They can be of three types: type 1, type 2 and type 3. Type 1 is confined to the crown, whereas the type 3 extends to the root and perforate in the apical area without any communication with the pulp. The most common is type 1 pattern, whereas the least common it is the type 3 pattern. The other is diluted form. Third is the radicular dens invaginatus. It occurs form as due to an invagination. It arises secondary to the proliferation of the Hartwig root sheet, with the formation of strip of enamel that extends along the root. So dens invaginatus, it is a tooth crown or root that has a deep fold lined with the enamel. The next is the peg lateral. The peg lateral, it is the term that is used when the tooth, usually the permanent incisors, are smaller and narrower than the usual. So it look like a peg. That means a small pointy tooth compared to the normal size teeth around it. The peg lateral, they often affect the maxillary lateral incisors. So a peg lateral, it is a small front tooth that looks like a peg or pointy shape, especially in the upper jaw. The next is the Hutchinson's incisors. Hutchinson incisors, they are the dental condition oftenly seen in individuals who had congenital syphilis. So here the incisors have a unique shape. They will have a notches at the biting edge. So the notches, they will look like a tip of a screwdriver. So in simple terms, the Hutchinson incisors, they are teeth with notches on the biting edge that can resemble the shape of screwdriver tip. So they were named after Sir Hutchinson, who was English surgeon as well as the pathologist who first described it. The next are the mulberry molars. Mulberry molars are the specific type of tooth abnormalities which are associated with congenital syphilis. So the mulberry molars, it is associated with congenital syphilis, resembling the texture of a mulberry fruit. The condition, it is caused by effect of syphilis on the teeth development during the pregnancy. So in simple words, mulberry molars, they are the abnormal looking molars that can develop in the people who had congenital syphilis. So what you will see a patient presenting with a bumpy surface that looks like a mulberries, and this happens because of syphilis affecting the tooth growth during the pregnancy. So here in this figure you can see the bumpy appearance. This bumpy appearance is the mulberry molars. The next feature is concrescence. What is concrescence? Concrescence, that is based upon the shape and the form of root structure. It is a dental condition where the two fully formed teeth, they are joined through the cementum, which is the hard tissue that covers the root. So this fusion happens at the root surface, often due to pressure or close proximity during the tooth development. They are seen frequently in the maxillary molars. The next is the enamel pearls. Enamel pearls, they are the rounded, small, abnormal growths of the enamel on the root surface. So you can see this enamel growth on the root surface, especially in region of furcation, where the root ends meets of the molar, especially the lower molars. So you can get an image in exam, and where you have to identify this. So it occurs most commonly in the bifurcation or trifurcation of near the bifurcation of the teeth. Maxillary molars are most commonly affected than the mandibular molars. The next terminology is the dilaceration. What is dilaceration? Dilaceration occurs due to the trauma or disturbance during the tooth development, especially when the tooth is forming. In the simpler words, dilaceration is when the tooth root is bent or curved in an unusual way. So that can happen if tooth experienced problems while it was growing. The other terminology is the flexion. The flexion refers to the bending or the curvature of the tooth root. So this bending can occur due to various factors including trauma, genetics, disturbance during the tooth development. So the flexion can lead to tooth abnormalities and it may impact the tooth position and alignment. So in simpler term, flexion means a tooth root bending or curving that can happen because of different reasons, and it affects the way the tooth grows. Other is the ankylosis. Ankylosis, it is also known as submerged teeth. What is ankylosis? It is a condition where the tooth it gets fused or stuck to the surrounding bone, preventing the normal movement. So this fusion it happens when the tooth root is directly attached to the bone without the usual layer of connective tissue in between. So the ankylosis it can cause the affected tooth to not grow or move properly, leading to issues like improper spacing or bite problems. So in simpler words, in ankylosis, the tooth is stuck to the bone and it cannot move like that it should. So it can cause problems with how the teeth fit together and how the jaw works. So it is also known as submerged teeth. So it refers to the situation where the tooth become fused to the jawbone and its position is below the normal level where it should be. So the ankylosis it is seen most commonly in the deciduous teeth, mostly in the mandibular second molar. So the ankylosis it prevents the tooth from erupting properly and it stays below the level where it should be normally in the. Moving next to the amelogenesis imperfecta. What is amelogenesis imperfecta? It is a genetic disorder that affects the enamel of the teeth. The enamel, it is the hard outer layer that protects the teeth from the daily wear and tear, as well as from the temperature changes and chemical. So in patient with the amelogenesis imperfecta, the enamel does not dwell properly. So that brings clinical sign and symptoms that includes discolored teeth that are smaller than the usual, irregular shaped teeth, and enamel that is thin, rough, or prone to chipping and breaking. So what are the genes that encode for the enamel protein? So these genes are the melanin, and the others. So number one is the enam gene. So the mutation will cause the enamel problems like thin or pitted enamel. Other gene is MMP20 gene. The MMP20 it makes a protein that helps the enamel development. So mutation will cause enamel issues known as pigmented hypomaturative variant. The other is kallikrein and KLK4 gene. This gene helps the enamel mature. The mutation in it will cause defects in the enamel maturation. Other gene is FAM83H gene. So mutation in this gene will lead to weak and poorly developed enamel. So it is common and severe, affecting the whole crown of the teeth. Other gene is DLX3 gene. So this gene helps with teeth, brain, and face development. So mutation will cause specific enamel problems and sometimes the taurodontism. Now let us discuss what are the various three forms of amelogenesis imperfecta. Three forms, they are hypoplasia, hypomaturity form, and hypocalcified form. So what happens in the hypoplastic amelogenesis imperfecta is, in this the enamel does not properly form. So in this the enamel will not form properly, that will result in thin enamel. So this thin enamel that will chip and wear off easily. So that is why the term hypoplastic enamel is used. The second is hypocalcified amelogenesis imperfecta. In this type involves the enamel that is formed but is insufficiently mineralized, meaning it lacks the necessary calcium content. So as a result, the enamel here, it will be softer and more prone to cavities and damage. So the term hypocalcified means low calcium level. The third is the hypoplasia amelogenesis imperfecta. The hypoplasia means underdeveloped. In this, the enamel does not develop to its normal thickness, so that will cause pitting and grooving or rough surface of the teeth. Now let us discuss the first form was hypoplastic amelogenesis imperfecta. The problem is the enamel matrix that is not enough, so that would cause a pinpoint pits. You will see pits on the teeth surface. So the enamel will be pitted, grooved, or very thin. So there is inadequate formation of the enamel matrix. Where you will see rows of pits, linear depressions on the middle third of the buccal surface. It has a generalized variant where the enamel is very thin, the teeth shape like crown preparation, the surface varies from smooth to rough with the pits, or it has a X-linked pattern. That has a lionization effect. So that means the X chromosome is inactive in females. It can have in the hemizygous male there is thin enamel in both dentition, whereas heterozygous female there is vertical furrows of thin enamel with the normal bands. Other form is the hypoplastic amelogenesis imperfecta. So the hypoplastic amelogenesis imperfecta, there will be reduced enamel thickness, abnormal contour. The enamel would be very thin over the occlusal and the interproximal surface. Other form is hypomaturative form. You will see the enamel that will be white opaque enamel with the mottling. The mottled agar brown enamel could be seen, and on post eruptive appearance, that would be brown discoloration enamel would chip down. Other important fact is the snow-capped hypomaturity pattern, which have a white opaque zone of crown on the incisal or the occlusal quarter to the third. So that would affect the teeth. Anterior to posterior distribution could be seen. It is seen in both the deciduous and the permanent dentition. The enamel can chip off easily. The radiographically you will see the affected enamel would exhibit radiodensity as similar as the dentine. The third is the hypocalcified amelogenesis imperfecta. There is poorly calcified enamel. So the enamel here shows the normal thickness and dentine-like density. The enamel is normal in thickness, normal form but weak and opaque or chalky in the appearance. So the radiodensity of the enamel dentine both are similar. The next is the dentinogenesis imperfecta. So what is the other name of dentinogenesis imperfecta? It is hereditary opalescent dentine. So what is dentinogenesis imperfecta? The dentinogenesis imperfecta, it is a genetic disorder that will affect the development of teeth, especially the dentine. So what you will see here is the abnormal formation of the dentine, that is the hard tissue that makes up the bulk of the tooth. So you would see a patient that will have teeth that are discolored, weak and prone to damage or breakage. So this dentinogenesis imperfecta, it can be inherited in an autosomal dominant pattern. That means that if one parent carries the gene mutation, there is 50% chances of passing it to their children. So the dentinogenesis imperfecta, number one, it is a hereditary disorder, affects the tooth dentine. Third, very important, it occurs due to the mutation in the DSPP gene. So which gene is responsible? DSPP gene. Or due to mutation in the dentine sialophosphoprotein. So you will see that the deciduous teeth, they will be more severely affected, followed by the permanent incisors, and first molars. With the second and the third molars, they will be the least affected. So what you will see, the teeth would be blue to brownish in discoloration. So the enamel that will frequently separate from the underlying defective dentine. On radiograph, you will see the tooth that are bulbous, that represents a bulbous crown, cervical constriction, thin roots, and early obliteration of root canals and pulp chambers. So the early obliteration of root canals and pulp chamber, it is a feature of dentinogenesis imperfecta. The tooth would be, the crown would be bulbous, there will be cervical constrictions and appearance of thin root. Some teeth will have expanded pulp that also known as shell teeth, due to the thin dentine and enlarged pulp. So these shell teeth are often associated with the dentinogenesis imperfecta. So what would be the treatment? You have to prevent the loss of enamel and subsequent loss of the dentine through that region. What we can give here is, to the patient, we can give is the cast metal crowns on the posterior and jacket crowns on the anterior teeth. That would be the best approach. Now, how do we classify dentinogenesis imperfecta? We can classify it according to the Shield classification or Whitcoop classification, that is type 1, type 2 and type 3. That is according to the Shield classification, and according to Whitcoop is type 1 represents the dentinogenesis imperfecta. Other classification, type 2 is hereditary opalescent teeth, type 3 is the Bradywine isolate. So remember these three classification. The type 1, it occurs in family with osteogenesis imperfecta. The primary teeth, they are more severely affected than the permanent teeth. Radiographically, you would see obliteration of pulp chambers and root canals. That is the key feature. In type 2, it never occurs in association with osteogenesis imperfecta. So it will have only dentine abnormalities and no bone disease. The type 3, it is Bradywine type. As discussed earlier, there is multiple pulp exposure in deciduous teeth, and it is not seen in type 1 and type 2. Other terminology is dentine dysplasia. So the dentine dysplasia, it is a rare hereditary dental disorder that will affect the development of dentine, the hard tissue that makes up the bulk of the tooth. So it is characterized by abnormal dentine formation. So the dentine dysplasia can be of two types. Type 1 is known as radicular dentine dysplasia. So here you will see the disorganization and shortening of the root dentine. The enamel and the coronal dentine, they are typically normal, but the radicular dentine lacks the proper structure, and often it leads to the shortening of the roots. So this condition may result in tooth mobility, early exfoliation, and radiographically the affected teeth exhibit thin enamel and dentine surrounded by enlarged radiolucent pulp. So that gives them a ghostly appearance. Type 2 is coronal dentine dysplasia. This type has a different appearance in the primary and permanent dentition. The primary teeth will show a translucency similar to the dentinogenesis imperfecta, while the permanent teeth will exhibit normal enamel and coronal dentine. However, adjacent to pulp, interglobular dentine areas can be seen. And the radicular dentine, it may be atubular, amorphous, and hypertrophic. So radiographically, the deciduous teeth, the roots are extremely short, the pulps almost completely obliterated. For the permanent teeth, it is you would see abnormal large pulp chambers in the coronal portion of the tooth. The next is the regional odontodysplasia. What are the other name of regional odontodysplasia? Odontogenic dysplasia, ghost teeth. So the regional odontodysplasia, it is a localized developmental abnormality that affects the enamel, dentine, and the pulp. It can be related to syndromes, growth abnormalities, neural disorders, and vascular malformation. It is more common in the maxilla, the maxillary teeth. They are more frequently involved, particularly the anterior teeth. They are more commonly affected. Seen in a deciduous dentition followed by the permanent dentition. So the affected teeth, they may fail to erupt, appear irregular with the rough surface, susceptible to caries, pulpal necrosis, and periapical inflammation. Radiographically, what you will see is there is a reduction in the radio density. The most important feature is the ghost appearance. So there is thin enamel and dentine. and large radiolucent pulp resembling a ghost-like appearance. Short roots, open apices, and prominent pulp stones, they are most commonly seen in the regional odontodysplasia. The treatment is due to the poor cosmetic appearance of teeth, you can do extraction with restoration by prosthetic appliance. Mouth.